One of the things, another resource that exists for people to look at who are interested in the way various regulatory authorities are responding to the challenges of globalization, there are two documents that the US FDA has published on its website that are available. One is called The Pathway to Global Product Safety and Quality. The other is one called Global Engagement. And I think in those documents you will find a much greater depth of discussion of the issues of globalization, a lot of the facts and figures, much more so than I've been able to give in this module, and really kind of an outline and a framework of how the US FDA is approaching the challenges of globalization, not only for medical products, but for the vast array of products that are in FDA's regulatory portfolio. And I think when you go through these documents and you kind of look at FDA's response through its international lens, there's several things you begin to find out. Is that, as we've mentioned, the fundamental mission of FDA has not changed. It is still a domestic public health protection and promotion agency. Its challenge now is how does it focus on that domestic mission while thinking not just domestically, but while thinking globally. But to do this in a way that is not to appear to be self-serving, that they're interested in the global situation simply as it applies to protecting Americans, that it's not self-centered, that they're doing this again because they're really interested in how this impacts Americans, or in a way that appears in some way arrogant, that really it's a matter of figuring out how as an agency that has a long history, like European agencies and other agencies, of being these independent agencies that have done the job and have focused on their domestic situation. How do they transform into an agency that is still domestically focused, but is much more integrated into and interdependent with the larger global regulatory enterprise, which is consisting of all of the other agencies who are looking at these products that are these global commodities. I think when you think about this, you have to remember that FDA is not missioned or funded as a traditional development agency. It's a public health agency. It's a domestic public health agency. And yet I think there are people in the larger community who don't realize that when it comes to missioning, when it comes to funding, when it comes to available resources, that really at FDA only around 500 people or so out of about a 14 to 15,000 numbers of people who work there focus full-time on international issues. And by that I mean people who are in the Office of International Programs, people who are on the border staff, people who are at the FDA foreign offices. These are people who really are focusing full-time on international issues. And so how can FDA leverage their resources, both these resources, those in the centers that are focusing on international issues, and the other resources, the technical, the inspectional, the other resources that FDA, the scientific resources that FDA brings to its decision making, or the European Medicines Agency, or Health Canada. How can they think about leveraging these resources in the way that will actually leave a footprint and not only bring their expertise to the table, but actually translate it as part of what happens in the larger global regulatory enterprise. And in order to accomplish this mission, as we mentioned earlier on at the beginning of this, FDA has to be more effective, at home. It has to engage more effectively abroad. And I know I'm focusing on FDA because this is for primarily an American audience, but this is true for the European agency, it's true for any agency. And they have to focus on what they need to do and realize what they can't do alone, and try to figure out how to get better information to help them in their decision making, What's hard is trying to figure out what are the appropriate metrics by which you measure the domestic impact of your international work. It's very difficult in many aspects of public health to come up with quantitative or even qualitative measures of impact. So much of it seems to be much more intuitive, but yet we live in a world where people need to know and people want to know what is really the quantitative or what is the qualitative impact of certain activities that you undertake. And the metrics by which a domestically focused agency measures domestic impact of their international activities is a difficult challenge that many regulators are trying to deal with in this post-globalization world. I think these agencies are now finding that international engagement is no longer discretionary. It's an integral daily part of how these agencies accomplish their domestic mission, and that they are all, if they're going to be effective, have to be much more effective part of the global regulatory community. There was a time in the latter part of the 20th century where people were beginning to have international interactions between regulatory agencies, and this was considered to be a discretionary activity. And I think what you've seen in the post-globalization world is that we were quite lucky in that formed the foundation for the interactions which are now no longer discretionary, but which are integral daily parts of how 21st century regulatory agencies do their business. It's a challenge for FDA, it's a challenge for EMA, it's a challenge for all regulatory agencies to begin to embrace this when, again, as we've said throughout this module, their focus has historically been, and their focus still is, primarily domestic. So how do you embrace, how do you get ownership, how do you get recognition of the added value to their daily work for this international interactions, and to be the resource that is available that you have to give to participate in the international regulatory enterprise versus the information that you get back, and trying to find the balance that regulatory resource expenditure really brings value into what you do. You have to figure out how to get from receiving information from trusted regulators to actually getting to the point of not only receiving the information, but feeling confident that indeed you can rely on that information to make your own regulatory decisions. Because then I think you've passed into a situation where you have true leveraging, you have true work sharing, and that's really the next big hurdle. And you're beginning to see it. I think there are agencies like the European Medicines Agency that do this to a greater degree already. And I think for them, that was part of the learning as they stood up an agency which is a network of agencies, that as part of their basic regulatory DNA, this idea of reliance, this idea of being a network that has to be interdependent, is a part of how they formed their structure. And I think it's one of the things, quite honestly, that EMA is able to teach as a major stringent regulatory authority to others in the world of how this can be done, and can be done in a very effective manner. I think when you look at the work that FDA and others in the international space have done, it really does form the foundation for kind of where this is going to go in the 21st century. And in the next module, we're going to be talking about the various things that people think are going to impact regulation in the 21st century. And this response to globalization and the further response to globalization, I think you'll see is one of the major forces that will be impacting 21st century regulation. But it's all built on the foundation of international work and international cooperation and relationship building that came out of the 1990s and the early 21st century, that really covered the full scope of regulatory procedures, such as cooperation on enforcement, The International Conference on Harmonization is probably the most impactful example of looking at how to harmonize regulatory policy and science-based standards and technical requirements for the development and marketing of medicines, looking at the scientific collaborations and exchanges that have occurred, the technical assistance and training both bilaterally and through multinational organizations like the World Health Organization and the regional organizations like PAHO. The outreach and the education about FDA expectations to manufacturers overseas who wish to ship their products into the United States, which has been done by not only FDA, but by other major regulators who indeed are trying to help manufacturers understand the standards that they're going to have to meet if indeed they wish to export their products into that particular jurisdiction. The assistance that regulators, be it FDA or others, provide to their trade to their trade agencies within their government. And I think as we get into the next module, you'll begin to see how the impact of trade and the importance of trade is really beginning to have an impact on regulation and international regulation, and what happens when a regulatory standard is considered to be a trade barrier, and how that plays out in the world of public health and the world of economic health, and how you try to address the needs of both. And finally, the emergency response and preparedness that we've all had to look at when there have been emergencies, both from a public health perspective, from a natural disaster perspective, otherwise from a humanitarian perspective, where the need for safe, effective, quality products is needed and is something that can't happen just in one jurisdiction, but something that can only happen when the regulators and the manufacturers and the multinationals are working together. So I think as we begin to think about what the idea is, what people as regulators are trying to get in this post-globalization world to help them make better decisions, first is better information through a series of initiatives globally that allows them to obtain better and more robust information so that people at the agency, people at their borders can make better decisions about the products that are being imported into their country. They're looking at ways to better leverage resources, be those human resources, scientific, financial, or inspectional resources, so that indeed they can avoid not only duplication of effort, but also at the same time use the resources that they have in a more efficient manner to allow them to be focused on really the higher risk areas from a public health perspective that are areas within their jurisdiction that only they can address, as opposed to others within the larger regulatory community. So there have been a history of special initiatives that have gone on, and it depends on the country, it depends on the issue that's being addressed, it depends on the level of capability in the various countries, the history of their interactions, the level of confidence, the ability of other countries to share and to maintain confidentiality of information. And really this whole issue that I was talking about a few minutes ago of, given the very restrained amount of resources, what is the value added to your own agency to be involved in this, and how do you measure that, and what are the metrics so that you can indeed show to your wider community and to show to those within your own agency that these kinds of interactions actually are paying off in better public health, not only for people throughout the world, but most importantly for an agency that has a domestic focus for those for whom you are responsible and for whom you're going to be held accountable. One of the ways that FDA has responded to the challenges of globalization and the need to get better information, to figure out how to leverage resources, to figure out how to be a global thinker in trying to figure out their domestic public health strategy has been the establishment of foreign posts. Now, there have been other parts of the U.S. government that had foreign posts for many, many, many years, but FDA did not have foreign posts until the 2007-2008 year occurred. And one of the responses to the various events that happened that year was that Congress gave FDA a special appropriation in 2008 to allow them to set up foreign offices overseas. And FDA did this in about a 12-month period, really starting from scratch. This was done with a tremendous amount of help from a sister agency, the CDC, which had people stationed overseas for many, many years and had a great deal of experience in posting people overseas. These agency posts overseas have now been in place for about 7 years, and after they had been in place for 2 to 3 years, further legislation, which was included in a food safety bill, actually Congress mandated that these posts continue to exist. So not only did FDA get an appropriation to try this experiment, but once they got these set up, Congress has now said these are indeed critical, these are important, and that indeed FDA shall maintain these foreign posts, or the idea of foreign posts overseas. When these were set up, these were chosen strategically based on some of the problems that existed in the past, but also on the ability of the agency to leverage expertise in other agencies and to build on a lot of the past experiences that we've been talking about. Currently, FDA has foreign offices located in China, in Beijing, in India, in New Delhi, in Latin America, in San Jose, Costa Rica, in Santiago, Chile, and in Mexico City. And then in Europe, FDA has an office located in Brussels that is really there to be an organization, a part of the organization that has a day-in, day-out focus on the European Commission. And actually one of the most unique elements of our foreign posts overseas, as far as FDA is concerned, is that with the European Medicines Agency, since 2008, there has been an FDA person who has actually been embedded in the European Medicines Agency on a full-time basis, and there has likewise been a person from the European Medicines Agency that has been embedded at FDA, so that within the agency there are people from the other agency who are there on a daily basis, who participate in the work, who are able to connect people in the two agencies that need to and should be working together, and have really been the nidus around much of the work we will be talking about that these two agencies have begun working on to address many of the issues that we have been talking about. One of the other things that these agencies are trying to get out of these post-globalization initiatives is better collaboration. And I think, again, this is this evolution from a world where there was no interaction to a world where there was some interaction, but it was discretionary, to a situation now where, because of the realities of the post-globalization world, that you have to have people whose full-time day jobs it is to foster these relationships, to champion these collaborative efforts, and to actually push and make them happen. In country, the activities that FDA personnel are involved in are really working with, for example, the counterpart agencies in those countries, and a full-time focus on the issues there and how they might affect U.S. consumers, and really championing on a day-to-day basis the initiatives that they're working on bilaterally between the agencies in the various countries. They do environmental scanning to try to gather better knowledge about what's happening in that country that might affect the quality and the availability of products from that country. For example, are there floods? Are there issues with products in that country? Are there other things that are happening that people need to know about that might have an effect on the quality or the availability of products from that country that are being exported to the United States? Within those countries, they also engage with other mature counterpart agencies to try to figure out how they can leverage resources and create synergies with their scientific, their inspectional, and the other resources that these agencies are expending in these various countries. When requested, they engage with counterpart agencies regarding specific technical cooperation projects within those countries. They also engage private and public sector third parties to provide information about regulated industry compliance with FDA standards. This is often engaging with the industries in those countries, not on individual products, but to help them as groups or as trade organizations to understand better the requirements for exporting your product into the United States. They engage with other U.S. agencies that are already in country, particularly other public health agencies such as the CDC, such as the NIH, such as the Department of Agriculture. There are a lot of other U.S. government agencies within these countries that have complementary missions to the regulatory mission that FDA has. And clearly, as many of the people that are stationed at these FDA posts overseas, not in Europe, but in the other posts that we've talked about, are inspectors. It gives FDA the ability to do inspections much more quickly, to do more inspections in country, and to work with the inspectorate within that country on inspections and leveraging resources that are available to inspect various manufacturing and clinical trial sites in these countries. So in summary, when we think about the impact of globalization on regulation, I hope through this module you've seen a tremendous shift in the past 25 years from the focus, from the way business is done, from how the agencies look at themselves in the context of other agencies around the world, to this post-globalization reality where all aspects of the life cycle have been impacted profoundly by the changes that globalization have brought. And it has meant a fundamental change in how these agencies view themselves, how they view the work they do, how they view themselves in relationship to other regulatory agencies and other resources that are available globally to help them do their job domestically better. And I think, as I've listed here, there's some fundamental truths that have come out in the past 25 years, one of which is no regulatory agency has the financial, human, or scientific resources to do all that its parliaments and people ask and expect of it. No agency can any longer meet its domestic mission by only looking within its borders. No agency or regional authority has a monopoly on good science or good regulatory practices. There is much to be learned from each other, and the development of 21st century good regulatory practices are not going to be something that comes from just one or two agencies, but which are now coming out of the experience of many competent agencies around the world. And as they're working together as this regional regulatory enterprise, the sum of their parts is clearly superior to their individual value, particularly in this world where the products, as we mentioned at the very beginning, have now morphed into these global goods. And that finally, regulatory collaboration is no longer discretionary. It is a best practice of 21st century medical products regulatory agencies, and it is something that, as we will see in a subsequent module, is only going to grow and be further refined as the 21st century moves on.